As a craniomaxillofacial surgeon, I treat patients that are born with clefts and other differences of the face and the skull, patients that have issues either from birth or development with their jaw, and also treat patients that undergo trauma to their face and may have fractures to the bony skeleton of their face. I think some of these reconstructive surgeries that we perform are complex, but it doesn't have to be complicated for the patient and their family. And it's important to us to really make sure that we take time together in our initial consultation and subsequent consultations to ensure that we're discussing the diagnosis, we're discussing the treatment, the prognosis, the expectation of results, that all questions are answered. And so as when we embark upon surgery, everyone's agreeable and understanding of the treatment plan. We're extremely passionate about the cleft care that we provide here, taking patients and their families throughout the cleft journey from infancy to adolescence, working in a multidisciplinary team to really ensure that patients, when they graduate the cleft team, are living their lives to the fullest potential. Facial trauma management really covers a wide spectrum of different challenges. It's an extremely privileged position to be able to be the ones that take care of them and get them back on track. I really want to make sure that we're doing that in the most cosmetic and aesthetic way possible. Craniomaxillofacial surgery is an extremely academic part of plastic surgery, and techniques are always advancing. And rather than holding on to specific techniques that I preferred or how I was trained to do, I think it's really important to stay at the cutting edge. We make sure all of our surgical procedures are performed in absolute state-of-the-art facilities with the most highly trained staff possible. I think the real goal of craniomaxillofacial surgery is to ensure that a patient isn't defined by the trauma that they sustained or the cleft that they happen to be born with or the issue that they developed with their jaw. I'm often really proud of these patients that have been through a really life-changing situation or something that they've been dealing with their whole lives. It's really meaningful for me that they're just simply thankful that we were the ones that were able to do it for them.